Hi folks, this is John Adamson, the Rehab and Documentation Guru, answering two questions for one therapist in one video. And this is related to documenting hot cold packs and pulse oximetry. So first of all, how do we write an order for interventions related to modalities and thermal agents? Well, in general, I've seen very generic orders for hot and cold packs, like just the use of thermal agents. My agency's done that. I've done it. So when you have a patient who has pain, multiple sites, we've been able to just utilize like a general instruction in thermal agents, hot, cold pack, etc., to mitigate pain. So it's been pretty non-specific. The sniff realm and working in compliance, when it came to modalities, we were more specific in how we documented the skill of application of modalities. And then of course, when you're doing hot and cold pack, you're not billing for that time. It's not reimbursable. But we would still document the educational component of where we had it applied, what anatomical structure, what was the clinical rationale, what was the patient's response to it, including skin check pre and post application. So in home health, for example, while my orders have been fairly generic for like thermal agents, cold, especially for like my post-operative knees and hips, I have documented very specifically at times. So like I'll have a generic ice heat order, and that apparently has been fine. I've not seen anything to indicate that it wouldn't be. And of course in home health, I'm not billing for separate interventions, I'm billing for my visit. So in addition to doing the rest of my skill visit, I have on occasion done like ice massage on my knee replacements, because, let's face it, ice packs don't always give them enough pain mitigation. And so I've done and taught patients how to do ice massage, and I will calculate where I am anatomically, why I'm doing it, what the patient's response was. I also sometimes document, what I tell the patient they will experience, like intense cold, burning, then numbness. And that way it's a demonstration that I know skilled-wise why I'm applying that ice. It goes along with the skilled intervention formula that I've advocated in my course, which is listing what you're doing, also listing the action that relates to the therapist involvement, the target of the action, which would include why you're doing that and the anatomical target, any special techniques that you're using, and of course things like response to care, alterations of that intervention over time, things like that. So anyway, that would be how I'd handle ice and heat. Probably don't have to be super specific with the actual order, but be specific about the skill when you're actually applying it in home health. What about pulse oximetry? You need orders for that. And I wish I could say I've always been 100% compliant with it, taking a measure and then having an order for it, because I know sometimes I've probably missed that. But pulse oximetry should clearly be indicated when you have cardio or pulmonary patients. And so the way I've handled the orders is pulse oximetry as needed, and that's basically it. Now, how do you handle the skill? Well, you apply a pulse oximeter, and you get a reading, right? And then if your reading's abnormal, then your analysis for that day's visit should include not only the analysis of the abnormality, but then what did you do about it? So if your patient had a pulse oximetry of 88 after doing some work, your note should indicate you did something about that. You altered the activity, maybe you gave them a 3-minute recovery, reassess, make sure it came back up. So the skill of the intervention, I would say, is much more important. And then you just have this generic pulse oximetry as needed order. And that should cover you fine from a compliance standpoint. Anyway, this has been John Adamson, the Rehab and Documentation Guru. I hope that helps. Take care and God bless.